By now, we've talked a whole lot about central sensitization or the gate control theory of pain and how it's contributing to your chronic pain. But what we haven't talked about yet is how one of your favorite foods might be contributing to it. That's right, gluten, that seemingly harmless protein, unless you have celiac disease, is actually contributing to your chronic pain through central sensitization, whether your doctor is telling you you're sensitive or not. And that is because of the gut brain connection. Throughout your entire gut, your stomach, small intestine, the large intestine, which I didn't draw, are hundreds of millions of neurons that make up your enteric nervous system, or what is known as your second brain. When you consume gluten, it puts your enteric nervous system under stress. See the last two videos on the mechanisms behind why that happens. And when that enteric nervous system is constantly detecting stress, it needs to tell the first brain that there's a problem. So your gut, via the vagus nerve, which connects the brain and the gut, says to your first brain, hey, we've got a serious issue here. We need help. Under normal conditions, your spinal cord puts up a wall, a gate, that prevents most information from traveling up your spinal cord into your brain. But when all of this is going on and that enteric nervous system is chronically activating and screaming out for help, we lose that wall and all the threats, whether they are important or not, make their way through to the brain. Now your brain's overwhelmed. Every little thing is competing for attention, and in order to get your attention, it has to produce more and more pain. And this is central sensitization, or the gate control theory of pain. And this is why gluten, which is seemingly harmless unless you have celiac disease, is actually driving your chronic pain.